Many of the parents who enter our environment are traumatised because it's a very different experience to what they anticipated in having their child.
I was really, really scared. The baby was in severe distress. So I had been a nurse here for about 8 years. When my son, Sam, was born 14 weeks early, I was transferred back here to Brigham Women's. I rolled back in as a patient, not as a nurse anymore. This was as risky as it gets, and whether or not that he would even survive. So honestly, I drew a lot on the past experiences of my other patients to give me hope.
Carter wasn't moving as much as he was in my womb, so Carter had to come out. Within 30 minutes, our whole life changed within a twinkle of an eye. Wasn't expecting that. Didn't have no time to prepare.
It was very overwhelming. It's a very high-tech environment, and there's a lot of alarms, there's a lot of sounds, there's other families around. It's certainly not what you pictured when you have your baby.
No partition, it's just open, you see everything. There's no privacy.
I would say the hardest parts of this whole thing is that, first of all, you have to leave your baby, and that is so unnatural. And that was something I found that I always warned moms, that's gonna be a really hard day tomorrow, you're gonna have to leave the hospital and go home. And when it happened to me, it was like, okay, this is tenfold.
Sometimes I felt as though I wasn't being a good mom because I left him behind. I feel as though he needed me for every moment, every step of the way, and I felt as though I needed to be here to advocate for him.
You know, you picture this moment of bringing your baby to your chest and bonding with them privately, and this is as far as you get from that.
Like a team of doctors run into the baby right next door to you, and you're trying to push your chair over to get out their way.
So the new facility, which is actually a 4-fold increase in footprint size for the care of our infants, is a massive undertaking that's going to take us about 2 years. We've already started construction, and it's going to be a beautiful facility where families can spend as much time as they like. We're going to have a neonatal neuro-intensive care, so that those first 5 days of life are really very critical. All of the areas for language that an adult has are present at term. And what happens when you're born prematurely is that you're right, the folding and the growth of the brain does not occur in the same way. And it doesn't occur in the same way in particular regions. And those regions seem to be influenced a lot by the stress that the infant has and the lack of certain types of environmental input like speech and language.
My heart sometimes would ache because I feel as though I needed that one-to-one time with him, and I felt as though being home, it was very hard.
So the private rooms are really the ideal environment for the family to recover. The presence of parents being able to hold and talk to and sing and touch and care for their babies dramatically reduces the amount of stress for that baby, and we believe is the most important thing to lead to improved outcomes and better brain development.
They have testimonies on the wall outside in the lobby, and reading that, I seen there was one baby that was only not even a pound, just ounces, and seeing this picture 15 years, when he's 15 years old, and I was just looking at Carter's situation, so I know that Carter's in great hands.
The infant isn't the only patient. The entire family is our patients.